Health is offering COVID-19 testing for first responders now. It's 7 spots around the state. But despite that, hospitals and doctors tell us there is still not nearly enough tests to go around. CBS 4 investigator Brian Moss live on that. Brian, you have more on why this remains such a significant problem.
Well, Jim, here's one reason. People can be carrying the virus around and have no idea. They can feel perfectly well, but at the same time, they can be infecting other people unknowingly. More testing could help identify and isolate those people, and it could slow the spread.
Even today, major hospitals in Colorado tell CBS 4 they can only test hospitalized patients, but not much more.
We've been begging for tests, we've been begging for personal protective equipment, and we haven't gotten it.
Denver-based emergency doctor Jane Janab says doctors and hospitals still don't have the supplies to do testing of everyone who they'd like to test.
We're seeing maybe, an estimate of 25% or more of people who don't have symptoms, but they have the virus, and so they're out there spreading it unknowingly. So widespread testing is incredibly important.
But that's not happening, and early promises have proved untrue.
Anybody that needs a test gets a test.
With not enough supplies or machinery, top testing priority goes to hospital inpatients and healthcare workers with symptoms. After that, Centura Health Dr. Stephen Cobb says others who might need to be tested are not getting it.
If we had the ability to test everybody we wanted, especially early on during this pandemic, we could have done a better job, in my opinion, of containing the spread of the disease.
Cobb says he can't predict when adequate testing will be available. Dr. Janab says it can't wait.
We need accurate tests, and we need a lot of them. The worst thing that could happen to a healthcare worker, somebody who has dedicated their lives to helping other people, is to be the vector, to be the person who is actually contagious and potentially infects somebody. Let's say somebody who is elderly, who has underlying lung disease and heart disease, and they die from this. I can't even imagine the guilt that I would have.
Now, one Denver doctor I spoke to today said for her entire clinic in Northwest Denver, she's been only able to get about 10 tests. And even with that, she says she has to send them off to a lab in Pennsylvania, and it takes 7 to 14 days to get results back. And she says that's not very helpful. Reporting live in Denver, I'm Brian Moss, covering Colorado First.
Tough battle for them, Brian. Thank you.